Welcome back to Healthhypes, where we help you feel better, move easier, and age smarter. If you're a senior struggling with muscle cramps, especially at night, or feeling weakness in your legs, you're not alone. These are often signs your body is missing key nutrients. Today, we're diving into the top 3 essential vitamins that help stop leg cramps, store muscle function, and improve circulation naturally. Let's get started. Before we get to the vitamins, let's quickly understand why seniors often experience leg cramps. As we age, our muscles lose flexibility, nerves become more sensitive, and electrolyte levels, like magnesium and potassium, can drop. Dehydration, medications, and poor circulation also contribute. But the good news is, with the right nutrients, these issues can be improved, or even reversed. Number 1. Vitamin B12. This powerful vitamin supports nerve function, red blood cell production, and energy levels. A deficiency in B12 can cause tingling, numbness, leg weakness, and cramping. Seniors are especially at risk because absorption declines with age. Common signs include fatigue, poor balance, and leg heaviness. You can find B12 in fish, eggs, dairy, and fortified cereals. If your levels are low, your doctor may recommend a supplement or injection. Restoring B12 levels can make a huge difference in strength and cramp relief. Number 2. Magnesium, the relaxation mineral. Magnesium helps your muscles contract and relax properly. Without enough of it, you may experience frequent leg cramps, stiffness, and even restless legs at night. It also helps regulate calcium and potassium, 2 other key minerals for muscle function. You can get magnesium from leafy greens, nuts, seeds, avocados, and whole grains. Magnesium glycinate and citrate are the most easily absorbed supplements for seniors. Talk to your doctor before starting, especially if you have kidney issues. Number 3. Vitamin D. The sunshine vitamin plays a crucial role in calcium absorption, muscle strength, and nerve function. Low vitamin D levels are linked to muscle weakness, joint pain, and increased fall risk. Many seniors are deficient, especially those who don't get enough sun or have darker skin. You can boost your levels by spending 15 to 30 minutes in sunlight daily, eating fatty fish and egg yolks, or taking a D3 supplement. A blood test can confirm your levels and guide proper dosage. Bonus tip: hydration is key. Even mild dehydration can cause or worsen cramps. Seniors often lose the sense of thirst, so make a habit of sipping water throughout the day. Aim for at least 6 to 8 cups of fluids, including herbal teas or water-rich fruits like watermelon or cucumber. Besides vitamins, here are 3 simple things you can do daily to support your leg health. 1. Stretch your calves and hamstrings before bed. 2. Elevate your legs to improve blood flow. 3. Use warm compresses or gentle massage if you feel tightness. Let's quickly recap the top 3 vitamins to fight leg cramps and restore strength. 1. Vitamin B12. Supports nerves and prevents muscle weakness. 2. Magnesium regulates muscle function and prevents spasms. 3. Vitamin D boosts calcium absorption and improves mobility. These vitamins, combined with hydration and light daily movement, can dramatically reduce leg discomfort and improve your quality of life. If you're experiencing nightly cramps or leg weakness, don't ignore it. Your body's asking for help, and nutrition may be the missing piece. Talk to your healthcare provider, check your levels, and consider adding these vitamins to your routine. Like and share this video with your loved one. Follow and subscribe to Health Hypes for more healthy tips.